This is my favorite job I've ever had, because working with these brand new families in the most vulnerable time of their lives is really a privilege. I'm Allison Rodasta, and I'm the social work care manager for the Women and Family Unit here at Lutheran Medical Center. My role is making sure that every baby born at Lutheran goes home with parents who are empowered with all of the resources and the tools and the support they need to be successful. And it's hard for me knowing that my time with them ends when they walk out the doors of this building. So to be able to hand them off to the capable hands of the Family Connects nurses has been not only a gift to the families, but it's been peace of mind for me. Lutheran Medical Center is the only delivering hospital in Jefferson County, so our patients come from a really wide, diverse background, all socioeconomic groups, and our challenge is really to make sure that we're meeting the needs of every one of those patients. Health equity is really important to us here at Lutheran, and we want to make sure that every single baby delivered has access to the same resources, whether they can afford to pay for it or not, whether they have insurance or not. All of those things really matter to us. And when Family Connects came in, it was just a natural fit to know that every single mom, every single birth-giving parent in Jefferson County has the opportunity to work with a nurse when they leave our building. My team and I are really grateful to work with Kate Follett and her amazing team of public health nurses through Family Connects, just their expertise and the caring that they bring to our patients. We know that this program has the ability to lower readmissions for moms and for babies, can head off breastfeeding concerns, can intervene if postpartum mood disorder starts to pop up with these families. So knowing that all of those things come with the Family Connects package, my hope is that we'll just continue to grow, we'll continue to widen the net of who enrolls in this program and who really takes advantage of this great opportunity.
In terms of our vision is a Colorado where all kids have their most basic needs met, when families are supported, where parents have a safe place for their child to sleep at night. That's our dream.
I'm Jana Clark, the Program Director of WeeCycle.
Morgan Seibel, WeeCycle's Executive Director. So WeeCycle provides things like diapers, wipes, baby food, formula, car seats, strollers, cribs, toddler beds, really like the list is endless of all the things needed for infants and toddlers. We are striving to work toward a Colorado where there is no diaper need.
We supply diapers to lots of different partners that serve Jefferson County, including Prosperity Partners and other entities. So we're able to send thousands of diapers, wipes, and supplies out to Jeffco families and make sure we're serving as many families as possible.
Diapers are important. If children don't have a supply of diapers, often they are not able to attend childcare, and if children can't attend childcare, parents can't go to work. Children with too few diapers, families budget their diapers and are using them for longer periods of time, which contributes to increased diaper rash and really some very serious health conditions. So if families are needing help with essential baby gear and supplies, there's a few different ways that they're able to access supplies from WeeCycle.
We partner with mobile food pantries and go out to underserved zip codes and provide food, diapers, wipes, baby food, formula at those markets too.
Most of our baby gear is distributed through our partner agencies. So if a family needs help with items like a car seat or a stroller or crib, they can look on our website and it filters by what county you're in, and it will show you which partner agencies we have that are working in Jefferson County or any other county. I would say that it's kind of both heartwarming and heart-wrenching sometimes. I think that while we're doing a lot, there's so much need and the need keeps growing. On the flip side, being able to distribute over 6 million diapers throughout the state of Colorado last year feels really huge and was more than we could have ever imagined. Just being able to talk to parents and just seeing the look of relief and the gratitude that comes with that is really what keeps us going.
I think it's been amazing. The team, both Jeffco and Vital Core, it's nice to see that we're, helping the population both here and once they get out into the community and they go home to their loved ones.
My name is Polly Abernathy. I'm the Detention Services Manager here at the Jefferson County Sheriff's Office.
I'm Esmeralda Ziegelman. I'm the House Service Administrator for Vital Core through Jefferson County Detention Facility.
I think our collaboration with the health department started during COVID. I think that was a time where we utilized them a lot to help us do some mass testing through our facility. So then when this came about, it was just like, how do we continue that relationship? And we have a duty to help people while they're in our facility.
Polly reached out to me and we all just kind of sat down to collaborate with our policies, our procedures, and just making sure that we were doing everything to protect both, the patients and then the community.
Since this one is focused on congenital syphilis, it's identifying the females that are in our population that meet the criteria. I think if you go to a general population and you say, hey, who wants to test for this? They're all going to be like, no, this is really embarrassing. So we had to find a secluded area and pull them up one or two at a time to really just give them that opportunity to feel safe to get that testing completed.
It's something that it affects everyone, not just our population within the facility, but on the outside. So it's helpful to get it out there, get them treated, get them the help that they need, because not everybody has that opportunity.
It eases some of that if we can utilize public health, because they can maintain that relationship as people get released. So it's just one more step of opportunity for people to get the treatment that they need in the community. So here in the jail we offer a variety of programs, and unfortunately a lot of those programs we're only able to offer while they're in our jail. So we can't offer that warm handoff. So having this opportunity with Public Health Department to provide that warm handoff and get these people the treatment ongoing. Maybe they get one treatment here and then they have to get 2 more in the community. Whereas if we didn't have that handoff, then these people may have to continue treatment. They may never progress with that treatment.
Just making sure that we were doing everything to protect both patients and then the community. So it's been a really fun adventure to go on with them.
We really use our farms as a platform for food justice, policy and advocacy, community development, community wealth building, educational programs, and just there's so many avenues for community connection that can happen when you bring food into the mix. I'm Meg Cayley. I'm the founding farmer and executive director of Sprout City Farms.
I am Jessica Cunningham, and I am the Community Navigator Food Access Program Manager of Mount Airport Community.
Our mission is to collaborate with communities to pursue food justice by cultivating educational, innovative, and restorative farms.
Food, I think, is the connector for a lot of community members, and I think especially in Jeffco around this area, we see a lot of injustice and insecurity that people are facing. Our mission really stands for making sure that people get the food that they need to feed their bellies and feed their families.
We're trying to identify as many barriers as we can that people are experiencing to accessing the food and being able to enjoy it, and try to break those down as much as we can.
Yeah, with those barriers as well, we have a veggie bike that we take out to certain communities. If they can't make it here, we bring a bike over there. And it's a low to no cost type of a farmer's market that we run at different neighborhood areas. This year we did 20 WIC boxes, we did 15 SNAP boxes, and then we did 10 Solidarity, which is people that might not participate in SNAP or WIC, but definitely there's a need for it.
Over half of the memberships in our CSA program were going no cost to folks with SNAP and WIC and the Solidarity shares.
We really saw a need in this park that there's a lot of people that don't have kitchens. So we started a pilot program, Friday Community Meals, where the farm crew would cook the food that we have from the field and invite anybody from the community that wanted to share a meal with us. We fed over 200 people over the season just through lunches.
We're about to enter a new era for this farm where we've been here for 10 years. We've been tweaking and improving the food distribution systems that we have had in place since the beginning. But we're really in a deep reevaluation phase right now, where we want to meet the needs of the community head on as much as possible, and recognize that a lot of our neighbors are unhoused and they're right here in the park, and we're the people that they are interfacing with, and how can we be more of a support system for that? We really see food insecurity as connected to everything that people are experiencing in this world.
It's a good feeling to know that we're a part of the community and we're doing something to support that as well.